Hello there, welcome back to your Thursdays this morning here on ITV1 and ITVX, and it's time to hear from you.
Yeah, we're joined by Dr Louise Newson now for our phone-in, taking calls on the menopause. Lovely to have you here.
Lovely.
Lots of people waiting to speak to you. So let's go straight to Julie, who's in Newcastle. Hi there, Julie.
Hello there, Ben. How are you?
Good, thank you. Great to have you on the show this morning. What's your question for the doctor?
Oh, thank you. Hello, Louise. So briefly, I was diagnosed with a brain tumour in September. I had a craniotomy and further treatment, which is working well so far. But at the time of my surgery, I was advised, due to risk of blood clots, to come off HRT, which had been on for about 5 years. And since coming off, I have experienced going through the menopause again with hot flushes and joint pain. I just really want to know if it's safe for me to go back onto HRT.
Yeah, so HRT is just 3 letters. There are different doses, there are different types. We usually give the oestrogen through the skin as a patch or gel, or there's a spray. Because it goes straight through the skin into the bloodstream, it starts working all the time straight away, but it doesn't increase risk of clot or stroke, which is really important. The natural progesterone as well doesn't increase risk of clot. So older types of synthetic hormones we wouldn't give if there's a risk of clot.
Okay.
But the natural body-identical hormones available on the NHS are absolutely safe. So you can still take HRT, which is likely to improve your symptoms again, but also future health as well.
Okay, great. Thank you very much, Julie. Now we're going to go over to Sarah. Good morning, Sarah.
Hi, Sarah.
Hi, what's your question this morning?
Hello there. Hi. So I'm 39 years old, and when Louise mentioned depression this morning, it took me by surprise, because I wasn't actually aware that depression is a symptom of the menopause. So I've got a lot of hot flushes, depression, anxiety, and it's completely unlike me, and it's been happening over the last year or so. So I'm just wondering, does she think that perhaps I might be going through the menopause at 39? Is this possible? And if so, what can I do about it?
Yeah, so mental health and menopause are really closely linked, actually. And when we've done surveys, we find that the most common symptoms are symptoms affecting our brains.
Right.
Because our hormones actually are produced in our ovaries, but they're produced in our brains as well.
They talk about, like, foggy brain.
Yeah,
almost,
so
don't they?
brain fog, low mood, anxiety, poor memory, reduced sleep, that sort of, I just don't feel
Up to
right.
par.
A lot of people say to me they just feel like everything's in black and white. It's not in colour. They're just existing, not living. And so we know that because our hormones work in our brains, a lot of people, when levels fluctuate and reduce, they can start to get these symptoms. Obviously, there are other conditions, such as clinical depression, that can occur, but it is very common, and the only way we know is by replacing missing hormones and C. But we also know that HRT is the first-line treatment for the low mood associated with perimenopause and menopause. Antidepressants don't work for the low mood. So if people have been offered antidepressants, they should be questioning, could it be related to my hormones or not, and looking at other symptoms that might be associated too.
And is there a way she can test her hormones so she can find out?
Yeah,
or is it hit and miss?
So there isn't, because our hormones, especially in the perimenopause, when hormones start to fluctuate, they can go up and down. So you might have a blood test that's completely normal. 10 minutes later, you feel rubbish and your level will be low.
Wow. Yeah.
So you can't do, so we're really careful. Younger people, we sometimes do blood tests, but actually it's more about looking at all the symptoms and thinking, is there any other reason why you might be feeling low or anxious? And sometimes there's similar symptoms to how people get just before their periods, when hormones naturally decline. So usually when women have had the information, they can then go, actually, maybe it is. And often we do what's called a therapeutic trial. We will try some hormones and see if they help.
Oh, OK, like trial and error a little bit.
It is sometimes, which we do a lot in medicine. If someone's got a pain, we'll try a first painkiller and try something else if that doesn't work. So it is having that conversation to think, could it be related? No one's too young to be menopausal. You know, I've got patients in their 20s and 30s, so you don't have to wait for a certain age.
So it sounds like it could be that, Sarah. Are any of your friends talking about this now?
Not really, because I only had a baby 2.5 years ago, so I'm still sort of in the baby stage of all my friends are sort of having babies still. So my hot flushes are like one big thing that's happening very, very often, which none of my friends are having at the moment. And I remember my mum speaking about hot flushes, and then that's what I'm linking. Perhaps, you know, I put weight on, which is not like me. I've not had any different lifestyle changes, and I've put a lot of weight on over the last year, especially around my midriff area. Everything is just kind of like pointing towards perhaps it could be the menopause, but I wasn't sure because I'm only 39, turning 40 this year, whether I would be in that category yet.
Yeah, absolutely could be, especially when people have physical symptoms like the flushes and sweats. There's other reasons why people can have flushes and sweats, but putting together with everything else, it could be related to your hormones. So it is definitely worth speaking to somebody.
OK, good luck with that, Sarah.
Thanks, Sarah. Thank you. Thanks.
Next up, we've got Nicola, who's in London. Hi, Nicola.
Hi, good morning, everybody.
Good morning.
Hi, it's a question. I had an emergency hysterectomy nearly 8 years ago. The only thing that got me through that is that I became a grandma at the same time. So the impact to me psychologically wasn't that bad. But I am having real issues in sleeping. I sleep for about 40 minutes if I'm lucky, and then I'm up. And it's just horrific. And I just need some help, please, because it's having an impact on absolutely everything, my work, my mood, everything.
That's brutal.
It is. Poor sleep is one of the commonest symptoms. I've been doing quite a lot of research into brain symptoms for I've got a tour coming up in autumn. And actually, poor sleep, it's a form of torture, isn't it?
Oh, yes. Well, they do it in the military to get information.
And so the number of women that I speak to who literally, like you, are really struggling with sleep. Yeah. And it is one of the first things that people thank me for when they come back, actually, when you get the right dose and type of hormones, because our hormones work with other hormones. They also work with melatonin. You've probably heard of the sleep hormone. Yeah. So if we've got low estrogen in the brain, you've got low melatonin as well. And so it's not just you're woken up with night sweats, actually your sleep cycle changes. And we know if you don't sleep well, of course, it's going to affect you mentally, but physically as well. So having had a hysterectomy, I don't know whether you've got your ovaries or not, but the ovaries often don't work as well, even if they're left in. So you could still consider having hormones of the right dose and type, and it often will improve sleep.
Nicola, do you still have your ovaries?
I've got my left one, but I've got my left one. But it was, when they did the hysterectomy, they found out that I had endometriosis. I've got so many different actual ailments, sciatica in my back. I've got IBS. I've got bulging discs in my back, and I've got disc degeneration. All of this has come as a result of having the hysterectomy.
Crikey.
So
and you're not getting any sleep.
Yeah.
No.
So our hormones are really anti-inflammatory in our body, and they work all around our body. Having an ovary or might mean that you still have some hormones, but clearly not enough. People with endometriosis are often told, well, you shouldn't just have estrogen because it can flare up if you've got some endometriosis left. But often we'll give progesterone as well, even though you've had a hysterectomy. Some women benefit from testosterone because it's very anti-inflammatory in the body. And that's why it's crucial you have the right dose and type. But certainly it will probably help some of your other symptoms. And also we know that women who take HRT have a lower risk of arthritis, depression, osteoporosis, heart disease. You know, there's lots of future beneficial effects as well.
OK, well, thank you so much for joining us this morning.
Yeah.
Nicola, good luck.
Good luck with that. That seems really, really hard.
I hope you find... Yeah, exactly. Thank you very much indeed.
Thank you.